Hey everyone, Chris here from MedPrep2Go, and I wanted to ask you to please follow us on social. There may be links in the show notes, or you can find us at MedPrep2Go on Facebook, Instagram, LinkedIn, and now YouTube. We would greatly appreciate it as we try to spread the word about MedPrep2Go and keep medical education accessible and affordable. Do you need a break from studying? Check out the Dr. Raj podcast, where he discusses topics such as wine with Jesse Katz, sarcoidosis with Bob Saget, Saving the Bees with Sydney S. Sill, and so much more. The podcast also features guest host Becca Spar, who focuses on leadership and connection, as well as Dr. Michelle Kulai in her Everyday Rooms segment, where she talks to patients to share their stories and the challenges that come with different conditions. Just search for the Dr. Raj podcast wherever you're listening now, and tune in for a variety of great guests and topics. Hey everyone, Chris here from MedPrep2Go, and I'm asking for your help. We are currently running a survey to better understand you, our audience. We're looking for feedback on the podcast, our qbank, and to see what kind of content you would be interested in so we know how to best direct our efforts. The survey will be open until March 31st. We recognize that your time is valuable, so as a token of our appreciation, we're giving away 2 annual subscriptions to the podcast of your choice for winning participants. Just enter your email at the end of the form, and winners will be contacted in early April. Please take a few moments to help us out and complete the survey at medprep2go.com/survey. Thank you in advance. Hey everyone, Chris here from MedPrep2Go, and welcome to another episode of our USMLE Step 1 Questions podcast. I'll be your reader for today, and in this episode, I'm going to be going over 3 neurology questions from our online qbank, which, of course, you can read all of these questions and more at medprep2go.com. And with that being said, let's get started with question 1, Neurology 7. A 62-year-old man is brought to the clinic by his wife because of rapidly worsening memory problems over the past 3 months. She reports that he was previously independent and cognitively intact, but has developed confusion, difficulty recognizing familiar objects, and frequent mood changes. Over the past 2 weeks, he has had several episodes of involuntary jerking movements of his arms, especially when startled. Review of symptoms is notable for insomnia and unintentional weight loss. He has no fever, headache, or visual changes. Past medical history is unremarkable and he takes no medications. Family history is negative for neurodegenerative disease. He does not smoke, drink alcohol, or use illicit drugs. Vital signs are within normal limits. On physical examination, he is disoriented to time and place. Neurologic examination shows hyperreflexia and intermittent myoclonic jerks of the upper extremities. MRI of the brain demonstrates bilateral hyperintensity of the caudate nucleus and putamen on diffusion-weighted imaging. An electroencephalogram, EEG, shows periodic sharp wave complexes. Which of the following is the most likely diagnosis? Is it A, Alzheimer's disease, B, Creutzfeldt-Jakob disease, C, dementia with Lewy bodies, D, Huntington disease, or E, subacute combined degeneration? And the correct answer is B, Creutzfeldt-Jakob disease. Creutzfeldt-Jakob disease, CJD, is a rapidly progressive, fatal neurodegenerative disorder caused by misfolded prion proteins, PRPSCC, that induce abnormal folding of normal cellular prion proteins, PRPC. Classic features include rapidly progressive dementia, myoclonus, and characteristic findings on diagnostic studies. MRI typically shows diffusion-weighted hyperintensity in the basal ganglia, and EEG often demonstrates periodic sharp wave complexes. The disease progresses over weeks to months and is uniformly fatal. Answer choice A, Alzheimer's disease, is incorrect. Alzheimer's disease presents with slowly progressive cognitive decline over years, not months. Myoclonus and characteristic EEG findings are not typical, and MRI does not show basal ganglia diffusion restriction. Alzheimer's disease is associated with beta amyloid plaques and neurofibrillary tangles composed of hyperphosphorylated tau. Answer choice C, dementia with Lewy bodies, is incorrect. Dementia with Lewy bodies is characterized by fluctuating cognition, visual hallucinations, REM sleep behavior disorder, and Parkinsonism. While dementia is present, the progression is not as rapid as in CJD, and EEG and MRI findings described here are not typical. Answer choice D, Huntington disease, is incorrect. Huntington disease presents with chloroform movements, psychiatric changes, and cognitive decline, typically beginning in mid-adulthood. It is inherited in an autosomal dominant fashion and progresses over years, not months. MRI shows caudate nucleus atrophy rather than diffusion hyperintensity. Answer choice E, subacute combined degeneration, is incorrect. Subacute combined degeneration results from vitamin B12 deficiency and affects the dorsal columns and corticospinal tracts, leading to sensory ataxia, weakness, and paresthesias. Dementia and myoclonus are not primary features, and MRI findings of the basal ganglia are not expected. Key learning point. Creutzfeldt-Jakob disease causes rapidly progressive dementia with myoclonus and characteristic MRI findings, such as basal ganglia diffusion restriction, and EEG findings, periodic sharp wave complexes, due to prion-mediated neurodegeneration. Question 2, Neurology 8. A 41-year-old man is brought to the clinic by his sister because of progressive behavioral changes in abnormal movements over the past year. She reports that he has become increasingly irritable, has difficulty concentrating at work, and has made several inappropriate comments in social settings. Over the past 6 months, he has developed frequent involuntary jerky movements of his hands and face that worsen with stress. Review of symptoms is notable for unintentional weight loss and insomnia. He denies headaches, seizures, or visual disturbances. Past medical history is unremarkable and he takes no medications. Family history is significant for a father who died in his early 50s after a long course of progressive dementia and movement abnormalities. The patient does not smoke and drinks alcohol socially. Vital signs are within normal limits. On physical examination, the patient is alert but has impaired attention and executive function. Neurologic examination reveals chloroform movements of the upper extremities and facial grimacing. MRI of the brain shows bilateral atrophy of the caudate nucleus. Which of the following is the most likely diagnosis? A. Alzheimer's disease. B. Creutzfeldt-Jakob disease. C. Dementia with Lewy bodies. D. Huntington disease. Or E. Wilson disease. And the correct answer is D. Huntington disease. Huntington disease is an autosomal dominant neurodegenerative disorder caused by CAG trinucleotide repeat expansion in the HTT gene on chromosome 4. It is characterized by progressive chorea, psychiatric disturbances, and cognitive decline, typically beginning in mid-adulthood. Neurodegeneration primarily affects the caudate nucleus and putamen, leading to the characteristic MRI findings of caudate atrophy. The family history of a similarly affected parent strongly supports this diagnosis. Answer choice A, Alzheimer's disease, is incorrect. Alzheimer's disease presents with gradual memory impairment and cognitive decline, typically without prominent movement disorders such as chorea. MRI findings involve cortical and hippocampal atrophy rather than caudate nucleus degeneration. Answer choice B, Creutzfeldt-Jakob disease, is incorrect. Creutzfeldt-Jakob disease causes rapidly progressive dementia over weeks to months, often with myoclonus and characteristic EEG and MRI findings. It does not present with a long prodrome of psychiatric symptoms or chorea. Answer choice C, dementia with Lewy bodies, is incorrect. Dementia with Lewy bodies is characterized by fluctuating cognition, visual hallucinations, REM sleep behavior disorder, and Parkinsonism. Chorea and caudate atrophy are not typical features. Answer choice E, Wilson disease, is incorrect. Wilson disease presents with hepatic dysfunction, psychiatric symptoms, and movement disorders due to copper accumulation. It typically occurs in younger adults and is associated with Kaiser rings on physical examination of the eyes and abnormal copper studies, which are not described here. Key learning point. Huntington disease is an autosomal dominant disorder caused by CAG repeat expansion that leads to caudate nucleus degeneration, resulting in chorea, psychiatric symptoms, and progressive cognitive decline.
This episode is brought to you by Indeed. Stop waiting around for the perfect candidate. Instead, use Indeed sponsored jobs to find the right people with the right skills fast. It's a simple way to make sure your listing is the first candidates see. According to Indeed data, sponsored jobs have 4 times more applicants than non-sponsored jobs. So go build your dream team today with Indeed. Get a $75 sponsored job credit at Indeed.com/podcast. Terms and conditions apply.
Zootopia 2 has come home to Disney+.
Let's go!
Get ready for a new case.
We're the greatest partners of all time!
New friends.
Gary the Snake.
And your last name?
The Snake.
Dream Team. And new habitats.
Zootopia has a secret reptile population.
You can watch the record-breaking phenomenon at home. Zootopia 2, now available on Disney+, rated PG. And right now you can get Disney Plus and Hulu for just $4.99 a month for 3 months with a special limited time offer. Ends March 24th. After 3 months, plan auto-renews at $12.99 a month. Terms apply.
Question 3, Neurology 9. A 58-year-old man presents to the clinic because of progressive weakness over the past 9 months. He first noticed difficulty buttoning his shirt and frequent dropping of objects. More recently, he has developed trouble climbing stairs and reports muscle cramps and twitching in his arms. He also reports mild dysarthria and occasional choking on liquids. He denies sensory loss, visual changes, bowel or bladder dysfunction, or cognitive decline. Past medical history is unremarkable and he takes no medications. Family history is negative for neuromuscular disease. He is a former smoker and drinks alcohol occasionally. Vital signs are within normal limits. On physical examination, there is muscle atrophy of the hands with visible fasciculations. Neurologic examination reveals spasticity in the lower extremities, hyperreflexia with bilateral Babinski signs, and decreased strength in both upper and lower extremities. Sensory examination is normal. Which of the following is the most likely diagnosis? Is it A, amyotrophic lateral sclerosis, B, Guillain-Barré syndrome, C, myasthenia gravis, D, multiple sclerosis, or E, spinal muscular atrophy? And the correct answer is A, amyotrophic lateral sclerosis. Amyotrophic lateral sclerosis, ALS, is a progressive neurodegenerative disease characterized by degeneration of both upper motor neurons, cortical spinal tracts, and lower motor neurons, anterior horn cells. Patients present with a combination of upper motor neuron signs, such as spasticity, hyperreflexia, Babinski sign, and lower motor neuron signs such as muscle atrophy, fasciculations, and weakness without sensory deficits. Bulbar involvement can cause dysarthria and dysphagia. Cognitive function is typically preserved, especially in classic ALS. Answer choice B, Guillain-Barré syndrome, is incorrect. Guillain-Barré syndrome is an acute immune-mediated demyelinating polyneuropathy characterized by rapidly progressive ascending weakness and areflexia. Sensory symptoms are common and upper motor neuron signs are absent. Answer choice C, myasthenia gravis, is incorrect. Myasthenia gravis presents with fatigable weakness that improves with rest and commonly affects ocular and bulbar muscles. Reflexes and sensation are normal, and upper motor neuron signs such as spasticity and Babinski sign are not present. Answer choice D, multiple sclerosis, is incorrect. Multiple sclerosis causes central nervous system demyelination with neurologic deficits separated in time and space. Sensory symptoms, visual disturbances, and MRI findings of demyelinating plaques are common, and lower motor neuron signs, such as fasciculations, are not typical. Answer choice E, spinal muscular atrophy, is incorrect. Spinal muscular atrophy is a genetic disorder presenting in infancy or childhood with degeneration of lower motor neurons only. Upper motor neuron signs are not present, distinguishing it from ALS. Key learning point. Amyotrophic lateral sclerosis causes combined upper and lower motor neuron degeneration with preserved sensation, leading to progressive weakness, fasciculations, spasticity, and eventual respiratory failure. And that will conclude this episode of our USMLE Step 1 Questions podcast. I hope you enjoyed it and found the information useful. Please be sure to follow us at MedPrep2Go on LinkedIn, Facebook, Instagram, and YouTube to stay up to date with our content. You can learn more and read other Step 1 questions at medprep2go.com. Happy studying! Hey everyone, Chris here from MedPrep2Go, and I wanted to let you know about our premium Step 2 Bundle podcast, which gets you all of the Step 2 secrets and our Step 2 questions podcast combined and ad-free. You'll also get early access to all of our Step 2 questions episodes before they're released public. The bundled podcast is available now, and you can save over 40% with an annual plan. Details at medprep2go.com.